Welcome, and thank you for standing by. At this time, all participants are in a listen-only mode. During the question-and-answer session, please press star 1 on your touch-tone phone. I will now turn the meeting over to Congressman Murphy. Sir, you may begin.
Thank you so much, and thanks, everybody, for joining us here today. It's my great honor to be here with two other prosecutors, and Mike Arcuri and Senator Amy Klobuchar. I'm big fans of both of them, and I'm proud as a former prosecutor myself. I was a special U.S. attorney and also a prosecutor in the Army as a paratrooper with the 82nd Airborne Division. I'm standing here with these other prosecutors to introduce a bipartisan bill that cracks down on the fraud and abuse that runs rampant to our healthcare system, wasting billions of taxpayer dollars and draining our government's resources. Every dollar we lose to fraud is a dollar that is taken out of the pockets of our taxpayers. The Improve Act helps eliminate fraud by requiring Medicare and Medicaid to reimburse their providers using direct deposit so that funds go right into an account at a bank or a credit union. And here's why that's important. Just last month, 8 people were indicted for attempting to steal $100 million from Medicare. That effectively would charge taxpayers for cancer treatments that were never provided. The 29 so-called health clinics that they operated were often nothing more than a P.O. box. These guys didn't take their payments to a bank where they would have been required to establish an account, provide verification for their business, and show identification. Instead, they took these checks to check cashing stores, which they also happen to own. There, at their own stores, they were easily able to cash millions of dollars worth of Medicare checks. This case is not an isolated incident. Millions of taxpayer dollars have been lost, and countless more dollars are at risk due to this check cashing laundering loophole. And that's why I'm proud to stand here today with Mike Arcuri and Senator Klobuchar. The Improve Act will fix this flaw in the system. And as we were told by federal prosecutors and the National District Attorneys Association, lax verification requirements at check cashing stores make it easy for scammers to commit fraud and then disappear without a trace. We'll fight for this bill to give our partners in law enforcement one more tool in their arsenal that they could use to do their jobs and crack down on the abusive practices that happen across America. It's also a matter of protecting patient care. Mm-hmm. As the AARP said in their endorsement, this is a common-sense, simple fix that will protect seniors' access to the health care they need, end quote. So I look forward to working with my colleagues from both parties to close this loophole in our system and lower the cost of health care for all Americans, especially our most vulnerable citizens. I'd like to now turn it over to Senator Klobuchar. I think she joined us, and it's an honor to work with her on this great bill.
Well, thank you so much, Congressman Murphy, and thank you for your great leadership on this bill. I just walked out of the Sotomayor confirmation hearing, so I'll be on here briefly and then have to go back to vote. But I just wanted to talk a little bit about my interest in this bill and why I'm sponsoring it along with Senator Martinez in the Senate. My view of this comes from being a former prosecutor. We had a number of cases where I saw firsthand how crooks cheated the Medicaid system and stole money that should have been used to provide care for vulnerable adults. We had one case where a woman bribed a county official and fraudulently billed Medicaid for services. So I saw firsthand the problems that we see. These criminals scheme the system to rob the American taxpayers of money that should be used to provide health care to those that need it most. It should be used to provide health care to our most vulnerable citizens and to our seniors. There's some great examples of cases where people have set up scams and why we need this law to pass. One example, just June 23rd of this year, 8 individuals were indicted in Miami for cashing $30,000 to $80,000 several times a week in 2 check cashing facilities that they owned themselves. They defrauded our healthcare system by creating phony clinics that churned out medical bills in 5 states. That was a federal indictment. Some of the purported clinics were empty storefronts with handwritten signs, while others existed only as post office boxes. By the time they were caught, they had bilked the government of $100 million. So when we're talking about why this is so important, remember that figure. Another example, December 2006, several people were arrested for operating a sham medical clinic that billed Medicare for treatments and services provided to health Medicare-eligible patients. They recruited fake patients, and they bilked the government out of $3 million. In November 2007, the Department of Justice indicted a woman for billing Medicare for motorized wheelchairs that beneficiaries didn't need and for children's services that were never provided. So time and time again, you see this kind of fraud. Law enforcement authorities estimate that healthcare fraud costs taxpayers more than $60 billion every year. And this means that potentially, we had a hearing on this in Judiciary, 20% of total Medicare spending can be lost to fraud each year. There's already work going on. I know from my work on the Judiciary Committee with Attorney General Holder and Secretary Kathleen Sebelius, they've committed to have their two agencies work together to set up a healthcare fraud prevention team. And Medicare regulations already require direct depositing of electric funds, but these regulations have not been uniformly enforced. I'm sure Congressman Murphy may have mentioned this already, but the bill has been endorsed by AARP and the National Association of District Attorneys and the Credit Union National Association. And additional benefits from this bill is the government can save money by not having to print and mail paper checks. The checks aren't lost in the mail. Healthcare providers and suppliers can get their money more quickly, and also directly depositing these funds into a bank or credit union account subjects those that would try to break the law to anti-money laundering laws. So this is a bipartisan bill, very important in the Senate in the middle of what is right now something of a partisan health care debate, and I'm hopeful that will change at some point. But this is a bipartisan bill. I'm proud to have Senator Martinez as my co-sponsor, and we will work together to get this bill through, either as part of the health care reform or on its own. Thank you.